microphones are working. This one's for everyone out there. This one's for the television.
Good morning, everyone. Thank you so much for being here. I'm really grateful to Miguel and Michelle, who you'll meet in a moment, for letting us crash their vaccination event. This is the city's 16th pop-up clinic, and it really demonstrates the approach that we've been taking. I want to thank all of our community-based partners for everything they've done through this pandemic, but we are finally getting to the other end of this crisis, and hope is on the horizon. We know that the city of Seattle has been doing everything it can through this pandemic to serve the residents. I can't thank our fire department enough. You'll hear from the chief later. Captain Wallace is here as well. We started standing up our clinics to make sure everyone could get tested. And then knowing that vaccinations were the road to recovery, we've partnered with Seattle King County Public Health, Swedish Hospital, community-based organizations, the Department of Health, everyone we could, to make sure we could get Seattle vaccinated as quickly as possible. It has been a difficult year for our city and our region. I was joking to someone earlier that no one told us that 2020 was going to be 18 months long, but we are close. The city of Seattle has really focused to make sure that we can give vaccinations equitably. You know, as a mom, I will tell you, any mother is only as happy as her least happy child. Well, any city is only strong if every part of its community is strong. It is resilient only if the city is resilient. And it only has hope for the future if every part of the community shares that same hope. I want to thank also our congressional delegation, Senator Patty Murray, whose office is here today, has been just a stalwart advocate for our city and our region throughout the pandemic, but particularly to get us vaccinations. As has our Congress, Pramila Jayapal and Adam Smith. I want to thank also Senator Cantwell and our partnership. You know, the city of Seattle has now had vaccination. Lumen did almost 8,000 doses this week. We had 30,000 doses that our clinics were doing this year. And this is particularly, to me, one of the most special ones. You know, Roberto Maestas was a friend of mine. He and the other civil rights advocates of the times, including Estella, knew that change and equity had to be not just sustainable, but sustained. And we as a city and a nation have fallen short in our commitment to equities. We saw last summer that so many people stood up and demanded that we really recommit ourselves to show that Black Lives Matter and that we treat our BIPOC communities and give them the same opportunities that everyone is entitled to. And so we have to recommit ourselves, and we know that these clinics are so important to making sure that we can reach communities that have been denied that same access, whether it's educational justice, healthcare justice, or the like. I want to thank our partners that are here today. The City of Seattle could not have been through this without our community-based organizations like Urban League and others. So you'll hear from others, and right now I want to introduce Matias, who will talk to you, but I want to thank everybody for this. I want the City of Seattle to know that we will continue to do all we can, but I am a broken record if I don't remind people. While we are close, we are not there yet. And while these vaccinations represent so much hope, we still need everybody to do what you need to do to keep yourself safe, your family safe, and your community safe. Wear your mask, keep your physical distance, don't have those gatherings. We've seen numbers go up here in King County at an alarming rate, and we want this kind of hope to really get us through this year. So thank you, and Matias, I'll give it to you. There you go.
Thank you, Mayor. This community vaccination event is exactly what we need to address inequities, especially in our Black and Latinx communities, which have been the most impacted by COVID-19. With vaccinations, we have accomplished so much. This week, we are celebrating the milestone of vaccinating 1 million doses here and administering them here in King County. Nearly 800,000 people in King County have received at least one dose. That's 100,000 more people than last week and represent over 43% of King County's residents over the age of 16. Nearly 26% of King County residents 16 and older are fully vaccinated already. Among older adults, 88% of residents 65 plus have received at least one dose. That is great accomplishment. Among communities of color and across all racial groups for the 65 and age and over group, we've been able to vaccinate over 70% of those populations for all racial groups. Although this is a great accomplishment, at the same time, our numbers for the Black and Latinx community are not as high, and we need to do better. And that's why these events are so important. As we expand eligibility, our goal is to have at least 70% of adults 16 plus across race and ethnic groups fully vaccinated by the end of July. Since our Black and Latinx populations have been heavily impacted, in fact, we need to get even higher rates in these communities. We are making progress in our efforts to continually increase vaccine access to communities of color. Each week since February, the proportion of vaccine doses going to people of color has increased. Public Health is working closely with the City of Seattle and many other partners to prioritize vaccine access and allocation to BIPOC communities. For example, we're conducting tailored outreach to essential workplaces such as restaurants, manufacturing, and childcare. Our outreach teams are making sure that staff know who is eligible and how to sign up. We're holding many conversations and sessions, including with City of Seattle partners and community organizations that are here today. Today's event with City of Seattle, El Centro de la Raza, and the Urban League is an excellent example of the many efforts to work with Black and Latinx organizations, working with trusted community leaders and partners. We will continue to partner with on these kinds of events to make sure that they are in environments that people trust. In terms of vaccine supply, these community efforts, along with healthcare providers and pharmacies and high volume sites, are ready to provide vaccine for all eligible adults. On April 16th, this coming week, the state is opening vaccination up to everybody 16 and older. We estimate another 800,000 people in King County will become newly eligible. At about the same time, our first doses for the state allocation is estimated to be about 40,000. There's a real gap here. And the state is anticipating a decreased allocation for the following 2 weeks, which will likely impact King County's allocation. Clearly, the supply over the next few weeks is not enough to meet the demands of the newly eligible. If we start to receive closer to 100,000 first doses, then it'll take at least 8 weeks to meet the estimated 800,000 residents who will become eligible on April 15th. So given these continued challenges, it is more critical than ever that we continue to prioritize our efforts on our communities and with our communities who have most been impacted by COVID-19. So thank you, and next I would like to introduce Miguel Maestas of El Centro de la Raza, who's also our host, and he's a friend. Hey, Mike.
Muy buenos dias. Good morning, everyone. Welcome to El Centro de la Raza, which we translate as the Center for People of All Races. On behalf of our Executive Director, Estela Ortega, who could not be here today, and our entire El Centro community, we would like to thank Mayor Durkan and the City of Seattle for your partnership, as well as the Urban League of Metropolitan Seattle. We are honored that El Centro is able to host today's pop-up vaccine clinic. With Mayor Durkan's support, community-based organizations are able to hold pop-up vaccine events like the one here today and others across our communities. It is so incredibly important to get the vaccine out to vulnerable community members. El Centro de la Raza has held 6 vaccine clinics, including today's, and have vaccinated over 1,000 people. We have 2 more currently planned and are ready to host many more. We have all seen how the COVID-19 pandemic has laid bare racial disparities, and that continues to be the case in relation to who is receiving the vaccine. Black, Indigenous, Latino, people of color, and low-income communities have been disproportionately affected by the pandemic, both by the percentage of people infected and the devastating economic impact. In King County, Latinos make up 10% of the population, but have been 22.9% of positive COVID-19 cases. When we look at who is getting vaccinated, 44% of King County's residents have received at least 1 dose of the vaccine so far. but only 29% of Latinos have received at least one dose. We have seen so many cases among people 30 to 45 years old. Many in the Latino community are essential workers, working in healthcare, childcare, and the food industry, including farm workers and workers in food processing, food distribution, supermarkets, and restaurant kitchens. These essential workers have helped keep us fed and cared for during this pandemic. Community-based organizations like ours are trusted places where people feel comfortable to get the vaccine. The ability to have trusted providers is key to overcoming these racial and economic disparities. It is critically important that we support vulnerable and underserved communities to overcome language and technology barriers and help people access accurate information to break down the barriers to be able to access the vaccine. We have seen through the clinics we have had individuals from our community tell us that they only got the vaccine because it was given here at an organization that they trust. As everyone in our state becomes eligible on April 15th, it will be extremely important that equity-centered vaccine distribution is front and centered as a key part of the strategy to overcome racial and economic disparities and ensure vulnerable people are vaccinated and we all overcome this pandemic together. Thank you so much. Mil gracias. Now please allow me to introduce the President and CEO of the Urban League of Metropolitan Seattle, Michelle Merriweather.
Good morning, and thank you, Mayor, and thank you, Matias and Miguel. It is an honor to partner with the city and King County Public Health, and especially El Centro de la Raza, as we move forward in getting our communities vaccinated. What I know for sure is that since the beginning of this pandemic, we did not stop. The Urban League of Metropolitan Seattle, El Centro, we dug deep and put our heels in supporting our communities. We have over 70 employees at the Urban League of Seattle, and we did not stop in serving our community. We provided resources, delivered food, made sure our kids had access to technology, and then moved to testing when necessary and when needed. And now it's the next step, and hopefully the final step in getting us back to some resemblance of normal. I hate using that word because certainly normal didn't serve all of us in an equitable way. But what we learned last year is that we now know what some of us have known to be true, that this has not been an equitable community always for all people. But as we realize that we are doing better, when you know better, you do better, right? And so we are on a pathway of ensuring that we're all served with equity, that we put equity in the center of everything that we do, especially now with vaccines. So last year, probably over 20% of our Urban League employees contracted COVID because they didn't stop. They continued to serve community. It was our outreach workers and our front office team. But once they were able, they were ready to go back to work and serve our community. And so once they were able, they were eager to stand in line and get their shot in the arm so they can continue to serve community and do it safely. I have to also recognize that putting our trust in healthcare, especially for the Black community, is a challenge and scary. And that is a fair assessment, as the community, as the healthcare community did not always serve us. But what I know for sure is that this is our chance at being able to see our families again, hug our loved ones again. And as for someone who witnessed hard times over the last year, it was especially important to be able to hug my dad before he left this earth. So I encourage all of us to do all we can and put our families and loved ones first and get our shot in the arm. And thank you again for your partnership and for leading with equity. And it is my honor and privilege to introduce Chief Scoggins. And thank you and your team personally for all of the work that you guys have put forth in ensuring our communities stay safe and get vaccinated. Chief Scoggins.
Good morning, and thank you all for being here. I want to lead with thanking our mayor for her ongoing leadership during this very difficult past year or so. We've had quite a few challenges, and without our mayor's leadership, we wouldn't be where we are today. So we should all be proud of that. And we have been partnering arm in arm with Seattle King County Public Health throughout this pandemic. First, we started along the testing line, and to date, our 4 city testing sites, we've tested over 707,000 people since June 5th of 2020. That's pretty significant in helping keep our community healthy. And our community-based partners, El Centro de la Raza, Miguel, you mentioned a number of the organizations who have had challenges getting vaccinated. Many of our pop-ups like this have served just those communities that you mentioned. And our community partner, Michelle, from the Urban League. You know, the Seattle Fire Department is proud and here to serve and stand in the gap. Since we started doing vaccinations on January 14th, we have now vaccinated over 53,000 people, 53,000 doses in the community. And that's pretty significant since 55% of those doses have gone to BIPOC communities here in Seattle. And that's over 200 different locations. So that's going into many, many places around the community. So I want to thank the community for trusting your Seattle Fire Department to come into your homes, your spaces, and allow us to continue to serve you. So thank you, and continue to work with us to get our community back on its feet. Now I'll turn it back over to our mayor, Mayor Durkan.
And I have to give an acknowledgement to Brian Wallace. I don't know if you saw him at the Mariners game, but one of our men of the year. I was waiting for him to throw out that pitch. Maybe next time, right? I just want to emphasize again how important it is to have clinics like this and trusted community partners. You know, we've looked at the data, and Seattle is leading the way on making sure that we have equitable distribution of vaccine. We're not only doing better than most people in the state, we're doing better than almost every city in the country. And that's because of our great partnerships with organizations like El Centro, the Urban League, the Filipino Community Center. It goes on because those are people who are trusted by the community. I can't say enough about King County Public Health. From the beginning, we've been in the trenches on this, and we could not accomplish it. But even with the 30,000 doses that we're giving this week, it's not enough. We have now almost 150,000 people on the wait list in Seattle. The pharmacy program is working in many places in the country. It's not working here in the Northwest. Of the pharmacy doses that come to pharmacies in King County, only about 14% of those doses are getting to pharmacies in Seattle when we're 33% of the population. So we continue to work with the federal government to see how we can get more, working with King County Public Health. The governor has been a tremendous, great leader in this. And we've seen the only way we got through this was by people pulling together. Business, community groups, philanthropy, city governments, up and down the I-5 corridor. And that's going to be the trick going forward because we have a lot of work ahead of us. We're going to have a huge economic recovery to do. And we have to remember that at every step of the way, including in that economic recovery, we have to continue centering equity to make sure that every community enjoys not just part of our prosperity, that when we come back better, stronger, and more equitable. So any questions?
With the numbers going up, do you still think it's a good idea to have fans at the Mariners games?
So the question was, with the numbers going up, is it a good idea to have fans at the Mariners games? We talk, King County Public Health, myself, and the governor's office are in constant communication. And when we moved to this level 3, everyone knows I was very cautious because we saw the numbers going up. Right now, we're looking at the numbers to see whether we have to go back, but I will say this, I'm very proud of the steps that the Mariners have taken to really make sure that they can have those games safely. We know that outdoor arenas are probably the most safe place to be in outdoor events. That's why you get to stand out here in this very balmy day. And so we're going to continue to look at that, work with the Mariners, work with the Sounders and others to see how we can continue to have those kinds of events where people come together. I will say, I was at Lumen Field on Wednesday, and as everyone knows, it was our largest day, almost 8,000 doses, and it was happening at the same time there was a Mariners game. And it was the perfect example of kind of that bridge to hope that our community has, how we're going to get back to normal. but we still have so much to get through to get there.
What are you doing to make sure teachers get their first vaccines?
The question was, since schools are open, what are you doing to making sure teachers get their first vaccines? As you know, all teachers are eligible, and there's been a number of pop-up clinics that we and others have done to get teachers vaccinated. And Lumen Field, we've seen, as we on the list of 100,000, we're also going by phases to make sure that those folks who are most vulnerable or most needed. I have to echo what was said before too. We would not have made it through the pandemic without our essential workers. You know, the folks who showed up to drive our buses, to work in our grocery stores, to work in our restaurants, you know, to clean our buildings. Those essential workers are why we were able to come through this as the city that had the lowest rate of disease, the lowest rate of hospitalizations, and the lowest number of deaths. And so we're really working to make sure those essential workers can get vaccinated. Thank you for coming. These events are a symbol of hope. Everyone I've been to, when people get those vaccinations, you can see that some of the weight of these last 12 and 18 months are coming off them, and they feel the hope. So thank you, everybody. And again, I've got to thank our community-based partners, the ones who are here today and the ones who have helped us throughout this. We're going to continue to rely on them because we have seen that this disease has not been equitable. It has hit our communities of color the hardest, both on the health impacts and the economic impacts. And we have an obligation as a society and a city to do what we can to really make sure that we're equitable. So thank you very much.